let's see about the preventive obstetrics. Preventive obstetrics means prevention of any disease or illness during pregnancy. Okay, so we will see three things. One is antenatal care, then we have intranatal care, and we have postnatal care. Coming to antenatal care, let's see about the visits. What are the ideal visits which are recommended under the antenatal care? So, according to the NHM, we have a mandatory of minimum 4 visits. That is, let's see on which week 1, 2, 3, and 4. First should be less than 12 weeks, then 14 to 26 weeks, then 28 to 32 weeks, and then 36 to till term. Okay, then the first one is known as the registration, should be done by ANC in this, and the rest are ANC visits, subsequent ANC visits. But the recommended visits according to NHM, which is recommended, what should be the frequency of visit? It should be like monthly, means once per month up to 28 weeks, like 7 months. That should be a total of 7 visits. Then once in 2 weeks, okay, once in 2 weeks till 32 weeks, okay, 32 weeks, that is on the 8th month, that will be 2 visits. Then weekly in more than 32 weeks, and that will be total of 4. So overall it should be 12 to 15 visits. Then according to WHO maternal care model, the minimum visit should be approximately 8. Now this is according to the trimester. In first trimester it should be 1 visit, second trimester it is 2 visits, and in the third trimester it's 5 visits. Next we will see about the screening. Screening gestational weight gain in reference to female of 55 kg, the average should be 10 to 12 kg. There should be increase in weight, and ideal is 10 kg. But post second trimester there should not be more than 2 kg per month weight gain. Now based on the region, it can be rural or it can be urban. So what are the tests done? Hemoglobin, urine protein, and sugar test are done in both rural and urban. But in rural cases we also do the malarial slide test, and in urban cases we do hepatitis B, VDRL, then HIV, then the test for gestational diabetes mellitus. If we check the hemoglobin level, so there is 3 levels. What should be the minimum level of hemoglobin to call it as anemia? So in pregnant women, if it is less than 11, in non-pregnant if it is less than 12, and in case of male if it is less than 13 gram per DL. Now let's see what happens in this gestational diabetes mellitus. Now it occurs in almost 12 to 14% of females. Now the screening criteria is initial screening is done in less than 12 weeks, that is in the first visit. Now this is done to prevent the fetal complications like macrosomia, metabolic changes like that. So what we do, first OGTT, that is oral glucose tolerance test, which is a one-step test and non-fasting test, in which what is done, 75 gram of anhydrous glucose is given. Then after 2 hours we will check the glucose level. If the glucose level is less than 140 mg per DL, then we will repeat this OGTT in the 24 to 28 weeks. Okay, now again we will do this test. And if it less than 140 mg per DL, we will call it as non-gestational diabetes mellitus. But it comes as more than 140 mg per DL, then we will call as GDM. Okay, here again when we give tested after 2 hours, if it comes more than 140 mg per dl, we usually call it as gestational diabetes mellitus. Now what we will do is we will do MNT, that is medical nutritional therapy, for 2 weeks. Then again we will do OGTT. If it comes as less than 120 mg per dl, or it will be more than 120 mg per dl. If it is less than 120 mg per dl, then we will say that it is responding to this MNT, that is medical nutrition therapy, so we will continue the therapy. But if it comes as more than 120 mg per dl, that means it is a failure of the MNT, so we will give insulin and metformin. Now this is seen in almost 2 to 3% of the cases. Now next we will see about the diet. Let's see about diet. What all diet is given. Now according to the body weight, we will see of non-pregnant, pregnant, that is first trimester, second trimester and third trimester. Then we will see in the lactational phase. So assume the body weight as 55 kg in non-pregnant and it increases by 10 here, and lactation we cannot say. Protein should be 45.7, but here it remains 45.7. Then in phase second trimester it plus 9.5 and plus 22. This is the requirement, that is gram per d. Then iron is 30, 27, 23. Then iodine is taken microgram per day, 150, 250, 280. Then coming to calcium, which is milligram per day, that is 1000, and it is 1200 postmenopausal. Then folate is taken as microgram per day, that is 220, 900 and 950. Vitamin A also microgram per day, 840, 900 and 950. Carbohydrate gram per day in 130, 175, 200. So there is this calorie intake. We should note that in pregnancy average plus 350 kilocalorie per day should be taken, but this is not an ideal advice to be given. So per trimester we will see first, second and third. The additional kilocalorie given per day is on the first trimester it is 70 to 85, then it increases to 230 to 280, then 390 to 470. Let's see about the supplements. In supplements there are two things given by Government of India, that is iron, folic acid and calcium supplements. The calcium supplements is given 500 mg, that is once daily, and this should be spaced from the IFA due to hindered absorption. So it's not given together, that is calcium and iron. So one should be given in the morning and the other should be given in the evening. Next is Anemia Mukt Bharat. What is Anemia Mukt Bharat? Now this is implemented under National Poshan Abhiyan. Okay. Now there is certain things, 6 into 6 into 6 strategy, that is 6 beneficiaries, 6 interventions and 6 institutional mechanisms. So what are the 6 beneficiaries? It should be less than 6 to 59 months, then 5 to 9 years, 10 to 19 years, 19 to 49 years, pregnant women and lactating women. And what are the 6 interventions, out of which 2 are important? One is prophylactic iron and folic acid supplementation, and the second is deworming. Let's see about this iron and folic acid supplementations. So the target group is pregnant and lactating females, then reproductive age group females, which is 19 to 49, which comes under Mission Parivar Vikas. Third is adolescent, fourth is 5 to 9 years children, and fifth is 6 to 59 months children. So elementary iron which is given is 60 mg, 60, 60, 45 in this case, and 20 mg in case of 6 to 59 months children. Then folic acid. Folic acid is given 500 microgram in reproductive age females and adolescents 10 to 19 years. In 5 to 9 years it is 400 microgram, and other cases also 100 micrograms. So these are given as microgram, and elementary iron is given as milligram. Then color, this is red. Again, reproductive age group is red. In adolescent it is blue, and in 5 to 9 years it is pink. Now what is the frequency in which it is given? Daily, once daily. Then the rest 3 are once weekly, and this is bi-weekly. Okay. Now what are the remarks? Now this in pregnant and lactating females it is given 4th month onward, that is 2nd and 3rd trimester, 6 months. 6 month post delivery, that is given up to 1 year. Okay, 12 months, which is 1 year. Then in the reproductive age group it is sugar coated. In the adolescents, all the girls are given and the school going boys are given. So how do we differentiate it? That's why the color is red in case of reproductive age group and blue in adolescents. Then in 5 to 9 years it is sugar coated, and in 6 to 59 years it is liquid solution. Then deworming is done. Second thing is deworming. Deworming is done in more than 6 months to 2 years, and then is more than 2 years. Here it is 200 milligram, that is half tablet, and here it is 400 milligram, which is 1 tablet. Now the frequency is given in twice per year, like in 6 months once, and it is given on 10th February and 10th August. Then testing and treatment of anemia. If there is an anemic pregnant female, it can be more than 7 gram %, which is mild to moderate anemia, or it can be less than 7 gram %, which is severe anemia. If it is less than 34 weeks, or it can be more than 34 weeks. If it is less than 34 weeks, 2 tablets of IFA is given daily, but not tolerant to IFA. Then if it is more than 34 weeks, we give IV iron sucrose or IV carboxymaltose. Now if it is severe, that is less than 7 gram %, what we do? If it is 5 to 6.9 gram %, or it can be less than 5 gram %. If it is 5 to 6.9 gram %, in case of first or second trimester, we give this iron IV iron sucrose and IV carboxymaltose. In case of this third trimester, we do hospitalization plus IV infusion. We can give or may not in blood transfusion, but if it is less than 5 gram %, then we usually do blood transfusion. Now the other causes of this anemia can be thalassemia and sickle cell anemia due to avoidance of IFA. So treatment can be folic acid. Let's see about the vaccines. Vaccine, we give this diphtheria toxoid tetanus vaccine. Diphtheria toxoid vaccine. Now it is the only vaccine given in pregnant female. Now diphtheria toxoid, TD or TD, what is the difference between small d or capital D? Small d means it is low dose and capital D means high dose, and it is 2 limit of flocculation, it is 25 limit of flocculation. This is given in adults, and the more limit of flocculation is given in children's. So what is the dose? Dose is 2 doses, which is 0.5 ml IM. What is the duration between the 2 doses? We should have 4 weeks of gap, and the second dose is preferably given 3 weeks prior to the date of delivery. Now if the person is the female is previously immunized, then this only one booster dose is given. So this was all about the antenatal care. Coming to the intranatal care. What do you mean by intranatal care? Intranatal care means care which is given during the delivery. So what we do is 5 clean deliveries. One is clean surface, hand, cord, tie and cut. In surface we usually give plastic sheet, in hand we give soap, and in cord we give gauze piece, in tie we give thread, and in cut we give blade. All these comes free of cost, and it is the component of the disposable delivery kit. The purpose is to prevent the disease like tetanus. In April 2015, neonatal tetanus elimination in India has occurred. Now, safe delivery. What is safe delivery? Safe delivery means trained personnel, they will be conducting the delivery. Now, coming to the next topic, that is the postnatal care. Now, according to the postnatal care, the visits, according to the government of India, either the mother or and the child, or by the healthcare workers, they will come to the centers, or this healthcare workers will go to the home. The home visits or in hospital visit, there should be 4 visits, like on the day 1, 3, 7 and 42. If there is a low birth weight, then we will be having 7 visits, that we will add 3 more visits, that is 1, 3, 7. We will add 14, 21 and 28, then the usual 42. These 3 are added. Then what do you mean by rooming in? Rooming in means presence of baby and the mother in close proximity. What do you mean by warm chain? Warm chain means the baby is covered to prevent hypothermia. Now the baby is covered after delivery, then weighed uncovered, then delivered to the mother covered. Then coming to kangaroo mother care. Kangaroo mother care, we have SANS, SAAN and S. What do you mean by S? S is skin to skin touch. Then we have airway disease prevention, then ambulatory benefit, then we have nutritional benefit which increases lactation, then we have the support, emotional support. Now this is mostly done in mothers, but in some areas we have this, some cases we also do kangaroo father care, but kangaroo mother care is more common. Please see.